And our guest this morning, Logan Health ENT specialist, Dr. Anna Knisely.
Hi, Anna. Thanks for dropping in.
So you're new around here.
Well, new and old, both.
All right. Explain that to us.
So I was born and raised in Libby, Montana.
All right.
And so I've had quite a journey since then through my medical training and practices. So coming back home in a way. My parents still live in Libby, so it's nice to kind of move back home in a way.
Oh, sure. Wow, that's great. Tell us about your travels.
Yeah, so I went to undergrad at Willamette University in Salem, Oregon, and then I was lucky enough to be part of the WWAMI program. So the WWAMI program is a program of Washington, Wyoming, Alaska, Montana, and Idaho, and it's for medical education for Montana students. So given that I grew up in Libby, I was able to join that program, spend my first year in Bozeman, and then graduated from the University of Washington. And then after that, I went to University of Pittsburgh, a medical center in Pittsburgh, Pennsylvania, for my head and neck surgery training. And then after that, I did a fellowship in Sydney, Australia.
Wow.
For a year in specializing in rhinology and skull-based surgery. So
Sydney, huh?
Yeah. Yes. So it was quite an adventure.
My
Now,
goodness.
rhinology, is that the nose stuff?
Exactly.
Nose stuff.
Stuffed up noses, fixing them. Yeah.
Exactly. So rhinology is the specialty of nose, breathing, sinuses, and skull-based surgery is going through the nose to get to tumors of the area that separates the brain from the nose and sinuses.
Maybe that's my problem, John. I have, I get colds and laryngitis.
At the same time,
It's
yeah.
like, that's why when I saw this word, what is otolaryng? How do you even say it?
Yeah. So it's otolaryngology, sometimes also known as otorhinolaryngology, which makes it even longer and even more difficult, right? So, or most people know it as an ENT physician. Okay. So ENT is a subspecialty that deals with the ear, nose, and throat disorders, all in those areas. We're surgeons who can both treat things medically and surgically.
So, I mean, you were an MD, so you could have done anything. Why ENT?
Yeah, well, it was kind of a weird road. I thought I was going to be a marine biologist growing up. And I started off studying fisheries in college. I was going to do freshwater first, and then I had worked for the Montana State Department of Fish, Wildlife, and Parks, and I was really interested in that. But in college, I saw a video, a NOVA video, on cochlear implantation. And it was so cool. It like struck all the right heartstrings, right? And made me kind of want to pivot to become an otolaryngologist. And I didn't end up being an otologist who does those cochlear implants, but it was one of those times where you're like, the otolaryngologists treat the senses, right? The sense of hearing, the sense of smell, taste, things like that. And the cochlear implantation seemed like such a gift to give to patients to restore the sense of hearing. And that just tugged all the right heartstrings. And
Wow.
Well, that's nice.
yeah.
So now you actually do surgery.
Yes.
Yeah.
I'm a surgeon. I love to operate, but I also, a lot of conditions within the head and neck don't always require surgery.
That must be weird getting into people's heads.
Well, I kind of like it.
So talk with us a little bit about some of the interesting things that you see.
Sure, yeah. So a rhinologist is someone who sees a lot of runny nose, a lot of drippy nose, can't breathe through the nose, sinus problems. I also treat all ages from pediatric patients all through the lifespan. So that's one of the kind of exciting things about our specialty is we don't necessarily get pigeonholed into specific age groups. And one of the most exciting things about ENT is, like I mentioned earlier, is you get to treat the senses and really improve patients' quality of life. For like kids who have chronic ear infections or recurrent ear infections and have hearing loss due to it, seeing those kids after they've had their surgery and their language blossoms and their parents aren't in and out of the pediatrician's office all the time and their infections are easier to treat, things like that can be really, really satisfying.
Well, those infections can come back later in life and cause some real problems for them as adults.
Certainly. Most of the time they don't, but tubes can be really effective for treating that kind of hearing loss. But some people have a little more complex problems.
A lot of people around here have runny noses all the time. Is that something you can fix?
It depends. Most of the time, there's a lot of good treatment, depending on the etiology of the runny nose, because there's a lot of different things that can cause a runny nose, and it can be very unique depending on what the patient's particular situation
See,
is.
after I eat, my nose goes crazy, and I have to blow my nose a lot, and I'm afraid that I'll find out that I'm allergic to all the foods I like. So I've never, really followed up on that.
Well, I've got some treatments for that if you'd like to come see me.
Okay.
But I think a lot of us just assume it's just, the environment. It's a cold day, something like that. But it could be more than that.
It can be. And that's why if you have something that's persistent, that's bothering you, and your primary care is not quite sure or treatments haven't worked before, I think come see me. I'll take a look in the nose. I'll try to listen to your history, and source out what the root cause is, and then treat that.
I don't like sniffing stuff up my nose. And these water things that I just don't like it.
Oh, the neti pots or whatever they call them.
Oh man,
Yeah.
Is that a recommended thing though, from a medical perspective?
So depends on the etiology. So nasal irrigations are what you're talking about, the neti pot or the Neomed squeeze bottle. They can be really helpful for some conditions and not so much for others.
Yeah.
And there's also other delivery methods for nasal sprays and things like that we can work through, because there are people who can't tolerate those things. And so there are other options.
Well, that was just the over-the-counter stuff, I guess. The
Yeah.
Flonase and things like that.
Yeah.
Yeah.
I remember Dristan back in the 70s because it said don't use more than 3 days. And I thought at 3 years, I got to stop using this stuff. And it's funny, since then I went to the doctor and I told him, I said, well, it says not to use more than 3 days unless if your doctor recommends it. I said, oh, okay.
Yeah.
That was the Afrin or something.
It's exactly, that's oxymetazoline, and that's the chemical name there. And it's true, you shouldn't use it for more than 3 days, 3 to 5 days at tops, because you can have something called rebound congestion.
Oh, yeah, I was getting that. And,
Yeah.
it's terrifying. I can't breathe. Where is that stuff? And so when I got a really bad cold, I thought, I'm just not going to use it. And so when I came out of the cold, when it finally went away, I didn't need to use it anymore. So,
See?
I think in acute episodes, things like an upper respiratory infection or cold, I think that it's okay to use over the counter for short periods of time.
Robin is an expert at self-diagnosis.
yeah, right. After the fact, hindsight is 20/20.
I really want to. We talked about ears, and you're able to help people with hearing issues.
Yeah. So ENT encompasses all those things, the ear, nose, and throat. And we work with lots of different team members, audiologists. One of the things that I'm really excited about this clinic that we're starting here at Logan Health is we will have a multidisciplinary practice or office. It's ear, nose, and throat, lung, and sleep medicine, because all these things are connected, right? If you can't sleep well, if you have sleep apnea, if you can't tolerate a CPAP or mask, we work together, because there's lots of different ways to attack these
That's
things.
fascinating.
Yeah.
Yeah. Robin has a mask.
I have the CPAP.
And I don't know how in the heck you sleep with that thing, Robin.
Well, I actually like it. I sleep really well flat on my back, where I never used to. I used to be on my side. And I even used it last night, with kind of a cold coming on, and I think it helped.
Yeah, it's because sleep quality is so important for not only how you feel day to day, but also it's important for your cardiovascular health, your heart, your lungs. So otherwise, there's a lot of strain there.
Yeah.
And the plan is to work with a pulmonologist, with the sleep doctors, all together so that patients get kind of the best broad care to increase their quality of life.
All right, so ear, nose, and throat. When I swallow, I can hear it in my ears. It kind of gives you an understanding of why it's connected.
Yeah. Oh, yeah. It's all connected. For patients who have chronic sinusitis or inflammation on their lining of their sinuses, that can sometimes drip down the back and sometimes can affect the lungs. So we're finding throughout time and studies that these patients sometimes develop things like adult onset asthma due to the postnasal drip going down the back.
Wow.
So we work together. I think it's all a team.
So we kind of played around with the nose pretty good. We've talked about the ears. What about the throat?
Yeah, so the throat is kind of interesting. There's all sorts of things around the head and neck. Thyroid problems, swallowing problems, speaking problems. And one of the great things about ENT or otolaryngology is that we have all the cool toys in clinic. So it's where I can look in your nose and I can look down your throat to help diagnose some of these problems.
That must be fun.
It was one of the things that I was very excited about as a resident.
I mean, for me, I've got my nose.
Oh, yeah,
See, now, ear, nose, and throat has been a specialty that's been combined together in practices for a long time, because I think I even recall it as a kid. Now, my mom told me it's the weak link. I used to get earaches when I was a kid, you know, and so... and she said, well, we took you to a baseball game. It was the cool night air, I think, that set you off. Well, I was probably breathing through my mouth or something. I don't know.
You know, that's really common. And you know how you had mentioned how when you swallow, your ears pop? That's because, again, it's all connected because there's something called the eustachian tube in the very back of your nose that allows you to pop your ears. And that's the thing that's working when you go over a mountain pass or on an airplane. It's all connected.
Oh, boy.
And from Logan Health, ENT specialist Dr. Anna Knisely, and ENT, that's ear, nose, throat, and they've added L to the configuration. Ear, nose, throat, and lungs is the name of the new practice that's all under the same roof, right?
Yeah, so that was a plan to share both clinic space, but also for collaboration purposes. Yeah.
Okay, now, where is it? Let's see, Rocky Mountain Heart and Lung was together in the Rock before. Are you in the same location, different location now?
So the Heart and Lung is on the second floor of the Rock, and we just moved right across the hallway. So we're still at the same location. The lung portion just moved. So now it's heart and vascular in the old clinic, and then ENT, lung, and actually sleep, which is a part of pulmonology or lung.
Well, you know, and it's funny because I've got all that going for me.
You can just one-stop shop, Robin.
Yeah. I've had a deviated septum repaired. I get the postnasal drip, and I'm always so careful when it's coming on. I drink lots of water and everything because I don't know if it's because of the way I sleep or whatever, but it coats my larynx, and the next thing you know, I've got laryngitis, which is not a good thing.
Did you expect to have to listen to this? You came here this morning.
But so the way what I do is I use like those sugar-free lozenges to try to keep my throat lubricated while I sleep. You know, and it works sometimes, but I've had laryngitis a few times through the years.
Boy, that's no fun in this business.
Yeah, you know, I remember there was a radio announcer from my residency who had chronic nasal drip, and it was actually affecting his career. And and because it was so prevalent, and he was having a hard time working. And I remember we operated on him and actually removed a nerve from his nose that then caused his nose not to water, and it was life-changing for him.
A nerve.
Now,
The nerve of it.
Yeah, exactly.
Was he dripping all the time or just after he ate tasty food? Yeah.
All of the time.
Oh,
he was really impacted.
Huh. Okay. Well, see, like I said, though, you know, somebody wanted me to have those scratch tests one time to see what I was allergic to, and I thought, I don't want to know that badly.
Talk with us a bit about this new practice and how it's all going to get organized.
Yeah, so I mean, it's pretty exciting to be co-located, to share an office and share a space with pulmonology, sleep, and soon to be allergy. So allergies are kind of what you were referring to earlier. Those are things that are in the environment that cause your nose to water, cause you to sneeze, all of those things.
Season changes, spring and fall, is when it usually affects me. So it could very well be environmental.
It could be very much. And so a lot of the testing is just doing a little skin prick test. And then that gives you some information for not only avoidance, but you can do things like immunotherapy, which can be either allergy shots, drops, or sometimes little tablets you put under your tongue. So that can really affect people's quality of life too, because it's giving your body little bits of whatever you're allergic to and tells your body, quit overreacting, quit watering, quit blocking, all of those things. So we're really excited to build this clinic in a way where patients can get multidisciplinary care from all different specialties.
You're pointing out some things that are just kind of, we put up with them because we think we have to.
Yeah.
Or because we always have.
You don't always. I think that there are many things within the nose and sinuses that people do just put up with. But once it's taken away, just like when you have chronic pain and then it goes away, you don't realize how good you can feel.
Okay.
Boy, that's a good reason to check out this new clinic.
I could have been a contender, John.
That's right. So you're still in the Rock.
Yes.
Okay.
In the Rock, the location is 350 Heritage Way, the second floor, and there's a big sign that says ENT and lung. So it's right up there, and you can find us there.
Okay, now if somebody recognizes these symptoms, obviously they're pretty easy to recognize, been putting up with them for a long time, can they contact you directly for a consultation there at the ENT clinic, or must they go through their primary care?
We're still working through some of those details. Sometimes I think it's good to see your primary care first so they can try some of the more easy things before they have to put you through a scope. But I'm happy to see patients. And so our phone number is 406-751-5455.
All right, try that again.
406-751-5455.
This has been really eye-opening. I think there's just a lot of people who put up with a lot of things that they probably don't have to. The only way to find out is to see an ENT specialist.
Yeah, and sometimes it's good to just gather information. If you decide, hey, I don't want to do that, that's okay. Then you get an opinion and say, okay, these are our options. And if you're like, I don't want to do any of those, I say, okay, great.
Nice to meet you.
Yeah, nice to meet you. And there's a Peloton instructor that says, I make suggestions, you make decisions. So
I love it. Dr. Anna Knisely, thank you so much for coming here. And it's neat that all your travels finally brought you back to Montana.
Yep, very excited to be home.